Hi, everybody. I'm Dr. Anthony Youn, America's holistic plastic surgeon, and today I'm going to talk with you about how vaping can destroy your nipples. Yes, it's true. So let's start off by talking actually about something that is a bit more established, but basically cigarette smoking. I've been a plastic surgeon now for 20 years, and I've performed thousands of operations. And one of the things that has always been taught to us is that you must stop smoking at least 3 to 4 weeks prior to any surgery in order to reduce the risk of complications. And the main complication we worry about is healing problems that can be, let's say, infection derived, but also these problems can cause tissue death. And so now the title of this video is how vaping can actually destroy your nipples. And that's a pretty crazy thing when you think about it, but it is actually true. So let me back up here a little bit. One of the most popular operations that we do in plastic surgery is breast reduction and breast lift surgery. And these are operations where we remove excess skin and sometimes tissue from the breasts, and then we move the nipple up into a higher position. Now, in order to do that, if you've ever seen this operation, I tell you, it is a big, potentially bloody mess of a surgery where you're essentially taking the entire breast apart, removing tissue from the inside, and then putting it back together again. And that is a big deal. Now, the reason why nipples can be a problem is because the nipple blood supply is altered with this operation. We typically keep the nipple and the areola attached to a portion of breast tissue through which blood vessels get to the nipple so that hopefully after the surgery, your nipples heal fine, you have sensation to them, and they heal without a problem. But what can cause problems is if there is not enough blood supply to heal. And if there's not enough blood supply to heal, whether it's your nipple or other parts of your body, those body parts can become ischemic. Ischemic means, or ischemia means insufficient blood supply to usually survive. So if something is ischemic, then that means a blood supply is insufficient. And if that blood supply is not restored, that tissue can die. And tissue death is termed necrosis. When something has necrosed, it means the tissue has actually died. So the worst thing that can happen if you have a breast reduction or breast lift, other than obviously death, is that you can have such major healing problems that you can literally lose your nipples. Yes, that has happened before where doctors have performed operations, breast reductions and breast lifts, and the patients have, their nipples have literally turned black and they have died. Now, knock on wood, I've not had any of that happen to any of my patients before, thank God. But there are patients who I have seen from other plastic surgeons in the area that has happened to. And there are a lot of ways to try to prevent it, utilizing the right type of surgery, not being over aggressive with the operation, and not smoking. So that's the big thing. So why is it then that smoking can cause problems with wound healing? Well, there are a number of reasons, and some of these we don't really quite understand. The first thing is nicotine, though. Nicotine obviously is in cigarettes. That's the addictive component of cigarettes, and it is known to basically constrict blood vessels, okay, to reduce blood supply. So if you're on nicotine, then you will have less blood supply to your tissues, and that can result in healing problems. Now, with cigarettes, you're also dealing with other types of things like carbon monoxide and all the other kind of chemicals, harmful chemicals that are part of cigarettes. And so when vaping came around and people started thinking, well, this isn't cigarettes, it's not, doesn't have all these other chemicals in it like the tar and all of that. You're not dealing with all the carbon monoxide and all that. So maybe vaping is going to be safer for wound healing than cigarettes. And, you know, it makes sense. It's a, you know, more of a controlled, group of chemicals that you put into a vape. And so the thought initially was that maybe this was a better alternative to cigarettes. And once again, if you have surgery, you're going to heal better with it. But unfortunately, the studies do not show that that is true. There have been studies that have looked at, typically these are animal studies. There are some human studies, but a lot of them are animal studies because vaping just hasn't been around that long, and so a lot of these human studies are still going on. But the studies do show that there is an impact on wound healing, a negative impact very similar to actual cigarettes. Now, interestingly enough, you would think, okay, that this is due to the nicotine then in the e-cigarettes, in the vape. But when people actually studied vaping without nicotine, that also showed problems with healing. Kind of weird. And so, what is that from? Is it from potential formaldehyde? Is it from maybe some of the plastic that some people believe that can potentially melt and can be breathed in? Is it some of these other chemicals that are part of the liquid that is put into these vapes? We really don't know. But we do know that whether you are vaping nicotine or not, the studies do show a negative impact on wound healing. So if you are having, let's say, a breast reduction surgery, your breasts are, let's say, a double D or a triple D, they're causing back, neck, and shoulder pain, and you see a plastic surgeon, and that doctor says, hey, do you smoke? And you say, no, I don't smoke, because you don't think vaping is the same as smoking. Then you have the breast reduction surgery, and after surgery, you look at your nipples, and they look purple. Then the next day, they look gray, and the next day, they turn black, and they can literally die, and you will have no nipples afterwards. That is a definite possibility. So once again, these studies do appear to show a very similar negative impact on wound healing with vaping as with cigarette smoking. So if you are going to consider having any type of surgery, whether it's plastic surgery or any other type of an operation, I strongly discourage you from vaping. At least, you want to quit at least 4 weeks prior to the operation and not vape until you are completely healed, which usually takes at least a month or so. And that's what I tell all of my patients. Now, it is true that there are certain operations that are riskier for vaping and healing than others. So I tell my patients, if you have, once again, a breast reduction, super high risk of healing problems, and you can definitely lose a nipple. If you have a tummy tuck, that also is very risky. A facelift, super risky if you're vaping. Some other operations, like let's say liposuction, because you're not lifting up skin, because you're not worried about blood supply, that risk is going to be lower with an operation like lipo than like a facelift where you're lifting up that kind of thin facial skin. So definitely if you're having surgery, stop the vaping. It's going to be better for you no matter what, but also can help you to heal. Final thought is hookah. I've been seeing a lot of my patients lately that say, I don't smoke, but then they do hookah. Well, hookah is basically flavored tobacco, and that too has nicotine in it, and that also can cause some major healing issues. So I hope this was helpful for you. If you are interested in other surgical types of information, check out this channel and definitely subscribe by hitting this button right up here. And I hope you have a great day. Remember, eat real food, use clean skincare, and autojuvenate before you operate.